Itching, 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 itching. Intense itching in the pubic area, in the genital area, okay? It's going to be itchy, all right? Pubic lice are parasites. That's right. Now, we tend to call pubic lice crabs, right? Because, well, they actually look like crabs, little tiny crabs. They're actually tiny insects, which usually live in our pubic or genital area. By the way, they're not really crabs, okay? They're pubic lice, but they look like crabs, just so we're clear. Sometimes we can find them in other areas where there's coarse body hair. So like hair on the legs, sometimes we find them in the armpits, mustache, beard, eyebrows, etc. I'm going to explain why we can find them outside the genitals. By the way, don't go anywhere. But back to the parasite part, because pubic lice are parasites. And remember, parasites basically need to feed on human blood to survive. That's kind of one of the definitions of parasites. It needs something else to survive. And just so you know, pubic lice are one of the 3 types of lice that live on humans. The other 2 types are head lice and body lice. And don't worry, each type of lice is different. And getting one type of lice does not mean that you're going to get the other type. Pubic lice move by crawling, okay? They can't hop, they can't fly, they crawl. And usually we get them through sexual contact, which is why we oftentimes see pubic lice in adults, right? Now, that's not the only way you can get pubic lice. And by the way, hang in there with me because I'm going to tell you if condoms prevent the spread of pubic lice. You're going to want to stick around for that. But as I was saying, sexual contact is not the only way you can get pubic lice. That's right. They can actually also be spread through physical contact with someone who has pubic lice. So you can get it through contact with clothing or beds or bed linens or even towels that were used by somebody with pubic lice. This is really, really important, okay? Because it's not just sexual contact. I want to sort of address the toilet seat issue because a lot of people wonder about things like this, if it can be spread via toilet seats. I'm going to link a video here that's going to talk more about toilet seat transmission. But according to Up to Date, which is a source that I often use for medical stuff, they say that getting a pubic lice from a toilet seat is unlikely because the organism gravitates towards warm environments and is not adapted to crawling on smooth surfaces. Now, in all transparency and fairness, I have read in other places that it is possible to get them through a toilet seat. So just want to throw that out there, okay? Now, let's talk about some of the symptoms. You're wondering, how would I even know I got this? Well, let me tell you, y'all. Itching, 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 itching. Intense itching in the pubic area, in the genital area, okay? It's going to be itchy, all right? You may also see nits, which are lice eggs, or even crawling lice. Now, not everyone sees this, but it is possible. And also, the symptoms actually can get worse at night because that's when the lice become active. So just take note of that, especially the itching, and then if it gets worse at night, okay? The other thing is that sometimes these lice can lead to redness and irritation, right? Because it's going to irritate you. So redness and irritation may be a sign that you see. And then if you have it in your eyelashes or eyebrows, you also might get eye irritation. Remember, I said you could get pubic lice in other parts, other hairy parts, because remember, it's not just sexually transmitted, but also transmitted through other ways. All right, so how will you know that you have this? Like, of course, the symptoms may be a telltale sign, but some people actually see the lice, or they may see nits. Sometimes it can be hard to find. Sometimes getting a magnifying glass can actually be very helpful, magnifying lens, okay? But this is the thing. If you have pubic lice, you should be checked for STDs. You should also contact your partner, etc. All of this stuff is very, very important. Now, by the way, let's go to condoms, okay? Because I know you're probably wondering, can condoms protect you against pubic lice? The short answer is not 100%, okay? Because condoms only cover one part of your genital region, right? The pubic lice can transmit from the other areas, the other parts of contact from your genitals that you may have, which I know is kind of annoying. But let me also remind you, though, that condoms are still very, 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 very necessary because barrier methods condoms protect against STDs, all right? So you still need to wear condoms. Please, please, please wear condoms. Please be safe. But understand that condoms are not going to 100% protect you against pubic lice. The good news is that there are treatments, okay? They're over the counter. There are also prescription treatments. There's a lotion that contains an ingredient called permethrin. There's also products containing pyrethrins and piperonyl butoxide. I had to practice that. Some of these products are available over the counter. Some of them are with prescription. And sometimes keep in mind that you may need more than one treatment. You may need to combine other modalities with the treatments, the medications that you get. So I think it's always a good idea to touch base with your doctor just to make sure you are doing the right thing and to make sure that you have all the treatment that you possibly need, okay? The other thing is that if you do have pubic lice, you should make sure you wash all your stuff, your clothes, your bedding, your towels, with hot water and dry them on high heat in your dryer, okay? Now, if you can't wash your bedding and dry it, up to date, this medical source that I often use says you can place your items in a sealed plastic bag. They go on to say that crawling lice die within 48 hours after removal, and items that can't be cleaned should be bagged or removed from the body contact for at least 72 hours. And bagging items for 2 weeks may eliminate the possibility of reinfestation from newly hatched lice. Guys, I hope this is helpful. Let me know in the comments if it was helpful. Share this video with other people. Let me know your experiences. Subscribe to my channel on YouTube. Follow me on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp, you name it, all the stuff. Go to my website also to sign up for my free weekly health newsletter at drjencaudle.com. Guys, I'm Dr. Jen. Love y'all.